At Merrill West Credit Union, we're working towards a brighter financial future for both our members and our community, knowing that when you succeed, we all succeed. Let's get acquainted with our Premier Savings for new members, now paying over 20 times the national average. Another great reason to move your money to a credit union. Learn more at merrillwest.com/Premier Savings. Merrill West Credit Union, working for you. Today, tomorrow, together. Insured by NCUA.
Because it is Monday and because I'm pretty sure we're still in a pandemic, we've been talking to our friend, Dr. Dennis Norem from Mercy Health for over a year now, where he gives us the medical take on what's going on. And today's Monday is no different. Dr. Norem, how are we doing this morning?
I'm doing well, guys.
We're doing well.
Good to be on.
Good to be on. Where are you here locally? Or are you out in Arizona right now?
No, back from vacation. Actually spent some time near Telluride, Colorado. Beautiful place.
Telluride, Colorado. That's a good time out there. Do you know somebody out there, or is it just a trip?
Through a connection, we got a house on an alpine lake called Trout Lake, up about 9,000 feet, and it was just beautiful up there.
Did you catch any trout in Trout Lake?
I caught one.
Caught one. Do we eat it, or do we send it back?
No, it was a small one. I sent it back. I was hoping to catch a bunch, but I'm a lousy fisherman, I'll be honest.
Hey, right around on a lake in Colorado, not catching fish is probably better than just hanging out at home. So that's.
Yeah, any day not catching fish is better than being in 100-degree weather in Tucson.
Yeah.
However, as you can see, Tucson got walloped with rain and a lot of flooding, so it's been interesting weather.
It has been interesting everywhere we go. I'm excited to have you here on today. I'm excited because mostly because we got Tom on the line here, who has boots on the ground, as we say, down in Florida, which is seeing a spike, and that's we've had you on for about a year now. And it seems, the messaging is pretty much the same that we've had. Go out, get vaccinated. Let's kind of put an end to this. That's been the biggest bugaboo lately. It seems like maybe opinions are shifting. Maybe some that were not on board with vaccinations are maybe starting to do it. Is this you have your own boots on the ground? You have your connection. Are you seeing with this Delta variant surging in close to home here down in Missouri, about to creep up into Illinois? Are you seeing at the hospital more vaccinations being taken? What is the feeling amongst your patients?
Well, I think we're seeing a little more a rise in vaccinations. I think the numbers indicate that. I'd be curious to see what Tom thinks down in Florida, as it appears to be one of the hot spots, along with Arkansas, Louisiana, Missouri, and I believe Nevada seem to have quite a rise because they had relatively low vaccination rates. So I'd be curious to see what he's hearing down there.
Yeah, it's interesting, Doctor. I'm just checking this out here, where we got the most number of cases in the last few weeks. It's increased dramatically here. It's made national news, of course. I guess nationally, it's 57% we have vaccinated, fully vaccinated, 57%. Whereas down here in Florida, I'm seeing just under that at 55%. So. And things are, down here in Florida, as you guys know, things are pretty relaxed. And they've been, pretty relaxed. We're at the highest rates we've seen since mid-January down here in Florida. Not in the area that I'm at. Most of this, obviously, is down in Broward County, down in the Miami area. I'm in the Tampa area. So up here, it's a little bit lower as far as statewide goes. But definitely seeing the numbers surging here with this Delta variant sort of leading the charge and whatnot. Again, primarily for hitting mostly unvaccinated people, according to the stats here.
Yeah, so we're in the Delta variant, something we've heard about for a while now. As I said before, it's very prevalent in Missouri, one of our border states. Another variant that I've been seeing some news reports is the Lambda variant. What do we know about the Lambda, and how concerned should we be in the area about that right now, Doctor?
Don't know too much yet about Lambda, and it doesn't appear that Lambda is going to be any worse than Delta, but I think we're not sure yet about that. And I think the other important thing about Missouri and Southern Illinois is I think the vaccination rates in Southern Illinois are similar to the lower vaccination rates in all of these states that are seeing the surge. And it clearly is the issue. If you're in an area with low vaccination rates, you're much higher risk of getting infected. Right now, that is the Delta variant. I heard a good perspective on the Delta variant. It said it took about 3 months for the UK variant to become the dominant variant. It's taken 3 weeks for the Delta variant to become the dominant variant, and I believe it's now 80 to 90% of all new infections are the Delta variant.
And we're still seeing, people, even though some that are the fully vaccinated, still coming down, are testing positive for COVID-19. Do we know that those being tested positive still the vaccine? Is that the original virus? Is this all variants that are affecting vaccinated folks, or a mix between the two? And is it still just you can still catch it, but it's still lightening the load that you get if you do come down with it, right?
Right. It's the Delta variant. As I said, it's probably 80%. There's some of the UK variant still floating around and some of the original variant, but it's probably 80% Delta variant. People who have been vaccinated are more likely now to get infected. However, the chance of having serious illness, being hospitalized, is extremely, extremely small. I think the number they're still quoting is 99.5% of all hospitalization and deaths are related to are in non-vaccinated patients. Having said that, though, there's still a small, very tiny number of people who've been vaccinated who are still at risk of serious infection, which is unfortunate, which gets back to our issue of why can't we get people vaccinated?
So if, let's say in a perfect world where, vaccines come out, everyone's excited about it, we get 70, 80, 85% vaccinated right away, would we have still been seeing these variants pop out? Would they come out just maybe it would have taken a little bit longer? Did we expedite the variant process? Could we have avoided them altogether? What do you think if we would have gotten on higher vaccine rates a little bit earlier?
Well, with higher vaccinated rates, it would have been much less likely if we could have vaccinated the whole world in a very timely manner. We would have seen very few variants. In large numbers of unvaccinated patients, you can kind of think the virus has time to mutate. It allows the virus to do this, and it creates these opportunities for mutation. If we could have gotten our rates within the last 3 to 4 months, I think up to 85, 90%, our risk of more variants would have decreased significantly. However, we're dependent on a whole worldwide population. So even if we would have done well, the variants would have still popped up, certainly in other parts of the world.
Yeah, we talk about other parts of the world lagging severely behind us in vaccinations, not just your third world countries. Where the Olympics going on right now, and Japan has a famously low vaccination rate. How's the world getting with catching up to the rest to us with vaccination rates?
I think things are improving a little bit. I think, however, you put a good example there where Japan, a country we would have thought that would have been well along in terms of vaccination, is at something like less than 20%, which is really kind of pathetic. Many of the European countries are starting to catch up, maybe in the 30 to 40%. Obviously, countries like UK have done better, and Israel's done quite well. They've probably led the nation. But many of the westernized countries are lagging way behind, and they're seeing the effects of that.
Is the majority, what's the main reason? Is it just vaccine availability, or is it vaccine hesitancy, other places like we have it here, that's slowing the rate down?
Well, it's still both, but in most of the westernized countries, I think the majority of it has been vaccine availability. My sister-in-law, who lives in the Netherlands, finally got her second vaccine shot. I think she got Pfizer just in the last week, and she was wanting to get it right from the get-go. She had no hesitation. So it's availability. Now, if you go to the third world countries, it's clearly availability. There just isn't any significant amount of vaccine for those countries to administer.
And as we start to see, numbers climb, I think everybody's getting nervous that we might have to return to a world that we were living in, 8-9 months ago. I personally don't think a lockdown would be accepted or enforced at all. But masks, will a mask mandate, you think, be coming down the pipeline here before we get back to back to school season?
Certainly a lot of discussion about that. I agree with you. I don't think any of us have the stomach for a lockdown. I don't think that's going to happen. I think mask mandates may be something that we're going to have to go back to, and certainly in areas where there's been these hotspots and outbreaks, it does make some sense. And unfortunately, mask mandates are the only way to get everybody to mask up, even the vaccinated people, because as we've mentioned in the past, many of the people who refuse to vaccinate are not going to self-identify and say, "Well, yeah, I'm going to wear a mask. I'm not vaccinated." They're just not going to. We've already seen that. So I think we are looking at the possibility of some mask mandates. And along with that, I think the area that's going to be most critical is vaccine mandates. You can see many major colleges and universities have announced that they're going to require vaccines, or else you can't attend in person.
Is a vaccine mandate going to pop up at hospitals, at doctors' offices? Do you guys already have one? What's specifically Mercy Health's stance on that?
We don't currently have one, but it's been announced that we will have one. I believe we've been given a deadline of, I believe it's October 1st. That all employees will need to be vaccinated by October 1st.
Since we do have Tom here, I do want to ask him. I have noticed, just going out over the weekend, grocery shopping and whatnot, I've already noticed a pop-up in people wearing masks out in public. Tom, do you notice any of that down in Florida, or is that messaging not reached our southern friends yet?
No, it's not reached anybody here, and there's. The governor of this state is very vocal about not wanting to mandate any of that, masks or vaccines or anything. As anybody probably knows, you just got to watch the news. He's been on since Florida's gotten all this attention of being the biggest hotspot right now in the country. So I'm not seeing any difference in my day-to-day life when I'm out and about with masks or anything like that anywhere else. But I can tell you this, as a person who is vaccinated and concerned about this, I've got it back with me, and it's one of those things where, I feel like I need to do my part in this. Whether I like it or not, personally, is pretty much irrelevant. I've got a responsibility for, who I'm around, the greater good, etc. That's my position. So I don't know if that's going to change down here in Florida anytime soon, especially with the messaging that we have, but we'll see.
This wildly altruistic view you have there, Tom. Do they know about that down in Florida?
I'm not sure, but, if any of them are listening now, maybe I could affect some change in my little tiny corner of the world here. So
that's good. Doctor, thanks for joining us. Before I let you go here, did we miss anything? Did you want to hit anything before we said goodbye?
Nothing else. I'm glad to hear Tom's comment. I mean, that's the whole point of getting vaccinated. Vaccinations protect yourself, and they protect other people who are around you, and I hope we can get more people on that message.
Absolutely. Dr. Norem, you join us again next Monday. I don't think the pandemic's going to be over by next Monday.
I wish it was, but I'll be talking to you Monday.
I appreciate it. That's Dr. Norem from Mercy Health.
The perfect holiday meal starts at Lucky. Make it memorable with beef bone-in ribeye roast, cut and tied for just $5.97 per pound with digital coupon. Limit 1. Or choose Cook's Spiral Sliced Bone-in Hickory Half Ham for only $1.97 per pound while supplies last. Lucky has everything you need to complete your holiday feast. And with select stores open Christmas Day, we're here whenever holiday magic or mayhem strikes. Now that's Holly H here at Lucky. Visit us online for store hours.